The situation with the state budget is all budgets are full of assumptions. And you make assumptions for revenue growth, income tax collections, and other things. And what's proven to be the case in the state budget that ends June 30th, 2010, is many of the assumptions around revenue, tax collections, etc., have not come true. And so we're halfway through the budget year, and it appears that there's $1.5 billion deficit. If you were to look at access and how it pays hospitals, there basically are, give or take, 8 different ways you get paid. There's an inpatient per diem, outpatient fee schedule, physician fee schedule, DISH, GME, behavioral health. And the real issue with our situation with Phoenix Children's is that we participate in all the programs. The cuts that have come through in the last 3 years, we've taken about $35 million in Medicaid reductions to date. Just the disproportionate share and GME cuts that are currently proposed would add another $10 million to that. Like all good businesses, we have been working hard to reduce our cost structure. Obviously, continue to increase volumes because volume does have something to do with spreading costs over things. So we've done a lot of things. For example, we have no traveling nurses in the hospital anymore. While that's better for patient safety, quality of care, and a whole variety of issues, it also saves us $7.5 million a year. We still have some profitability left in terms of the organization, but it's foolish to gut programs for short-term issues. We've been focused as an organization a lot more on trying to fix the issue, and there are mechanisms used by many other states to generate additional Medicaid funding. Well, I mean, one of the things we've been doing is spending, it's just as you said, a lot of time educating the legislators of what is the implication of these various. Recently, last week, I spent 2 hours with the Speaker of the House, Kirk Adams, going through in detail the magnitude of these cuts, what do they mean, how does the Medicaid program actually pay hospitals. And so that we've been doing this, we've spent an enormous amount of time in this education process. But what we're trying to do is try to drive towards it. I went to a meeting recently that the governor and her staff put on, her budget people and her advisors, which pretty clearly shows that the ability to cut the way out of this is impossible. Because again, if you go to what there's $1.5 billion shortfall, the total amount of budget that could actually be cut because of voter initiative, protection, maintenance of effort through federal programs, etc., is $1.3 billion. So if you cut everything you possibly have the flexibility to cut, you can't get over the hump. Phoenix Children's has been very out front in terms of pushing for solutions to the issue, not just don't cut us, don't cut us. We're looking for solutions, and one of them is a concept called a provider assessment. It's used right now by about 30 other states, and the concept is that you put a quote-unquote assessment or tax on hospital revenues to generate the dollar that gets matched with 2 to 3 federal dollars, and then it gets redistributed back to the hospitals. You know, that has the potential to add a significant amount of dollars, new dollars, to the state Medicaid program. So I think it's time for legislators, they've got to become pragmatic, they've got to become leaders, got to get off the ideologies that are out there, either right or left, and they're both just as bad, and get back in the mainstream and figure out how to fix this problem. Because we're at the point we're going to do incredible damage to the infrastructure of the state. But it's not just healthcare, it's education, it's higher education. There's a lot on the table right now. And again, we need some leadership.